So we can talk about a lot of things, and why don't we start with total body photography? I know that this is something that you're really passionate about, and you actually sort of pioneered the whole process. Maybe walk us through, what that is and why it's actually helpful.
Sure. So I was actually not the pioneer of total body photography. It really started with my mentor, which was Wallace Clark. And basically, Wallace was among those who first recognized that you could identify a subset of people who are at increased risk for getting melanoma based on what their moles look like. And so there was a lot of epidemiologic work back in the 1980s that found that the more moles you had, the more likely you were to get melanoma. And the funkier your moles looked, the more likely you were to get melanoma. And Wallace actually gave a medical name to funky looking moles called dysplastic nevi, which really means dysplastic means looks abnormal under the microscope, and nevi is plural for nevus, which means mole. So basically, it means funky moles. And once it was recognized that if you had a lot of moles and they were abnormal looking to begin with, you were more likely to get melanoma. The question became, how can we find the melanomas on these patients earlier? And how can we avoid doing a lot of unnecessary biopsies on patients who start out with a lot of moles that just don't look quite right to begin with? And it was really Wallace who in Philadelphia and Al Kopf in New York who pioneered the use of total body photography as a way of monitoring people who had what we call a high risk phenotype, or the kind of skin that was more likely to develop melanoma, so that we could monitor their moles and find the melanomas early, because cancer is a dynamic process. So if it was cancerous, it was going to be changing. So if you saw something changing, you could spot an early melanoma, while at the same time avoiding a lot of unnecessary biopsies, because if they were perfectly stable, cancer doesn't just sit there. And so that was really the mindset. And believe it or not, we used to do this with real pictures. So each patient had their own photo album with 5x7 prints in it. And the patients would come in and we would compare them to their pictures. And where I got involved was really helping to bring this into the digital area, where digital photography was becoming much more popular in the late 90s. And I came to Memorial Sloan Kettering in part to create a program where we used digital photography to accomplish the same thing.
Yeah. Alan, are there any studies out there that actually demonstrate, total body photography actually can detect melanoma early and at the same time help to avoid unnecessary biopsies?
There actually are a few studies out there. One of the best is out of the group from the University of Barcelona. And indeed, it shows exactly that you can, the number of benign lesions that get biopsied for every melanoma detected in centers, including ours at Memorial Sloan Kettering, are down on the order of, 2 to 3 to 1. Whereas out in the community at large, those numbers can go up to 30 to 1, 50 to 1. So you clearly can reduce biopsies. And in our experience and the experience of other groups, almost all of the melanomas that are detected very early.
Yeah, I mean, I think one of the challenges, this kind of technology is not really readily available, right? And but I think it's becoming a little bit easier nowadays with digital photography.